I'd like to make a quick introduction. My name is Michael Landau. I'm the founder of CTI LifeHealth, and I'm going to bring you through a journey of what we've created. And you should know several things. Number one, I look very Mzungu, but I'm actually Akiki, which is an Mbako. From Uganda, from a couple of kings. I've been in the region for many years, doing a lot of interesting business, and I'm sure when we talk, we'll have many, many people in common. But be assured that everything that you are going to see and everything that we have built has been built in East Africa, primarily Uganda, but now also in Kenya. Everything has been built in East Africa by East Africans for East Africa. This is not a Mzungu plan from America that we're just saying, eat this, it's good for you. This has been very, very much developed, kind of locally. And everything that we've developed over the last 5-6 years, or even a bit longer, 6+ years, has been developed based on, kind of needs and based on our understanding of how to create a comprehensive ecosystem for healthcare that is appropriate for the East African environment. And what evolved with all of this was that we ended up creating a very comprehensive digital ecosystem. And it's not been designed in competition to anything that any government has done until, less than a year ago or 6 months ago. We weren't even aware of the concept of the superhighway, which is a beautiful one. And we weren't, and every government's been doing some of their, kind of initiatives, but we also know how difficult it is for government officials who are really responsible for monitoring, evaluation, providing the regulations, providing the ecosystem for which, private companies can work. But again, in the African environment, the challenge is that the private sector aren't rising to the occasion. So we were not aware of a lot of the things. So please don't take any of the things that we've built as a challenge. But really, we've built everything ourselves. We built it. So anything that you see and that you like or that you want us to change, we can change. But it's been done with purity of impact. How do we really make a difference? And we focused our solution, and I'm going to show you share my screen for a moment. So it's been done with the patient in the middle. The focus has been on the patient, and that's here in the middle. And I'm going to show you the application of the patient. And through this, walking clockwise. So we've got the patient at the center. Everything is very patient-centric. So we've really built a system that the National Health Insurance Fund, if it still exists, or the new version of it, could provide a wallet to every single person in the country, and people have full access to all of their records. And I'll show it to you. You'll see how the government can be managing all their infrastructure. You'll see how we've built a program for all the health facilities so that literally within a week, if you wanted it, but certainly logistically within a few months, every health facility in your country would be able to have a digital platform with an HMIS, a lab management system, a fully integrated LifeHealth, which includes the patient wallet, will also include telemedicine, and including data visualizations and analytics and integrations into whether you want to continue to use the DHIS2 system or use your own system. All the data is all built on one master database. So you'll have the ability to go and deliver the data wherever you need it. And then everything is in one master data lake. Then you go to the health workers. So we've developed applications for the health workers so that they can be operating independently. But again, everything is all in one integrated solution, with them having access to the patients and the records, obviously with permissions. And these are all things that we can be defining even more specifically with you. And then from within that, of course, we've got data that we can do health product sales. So the idea is that we want to be able to create the village health teams throughout the country as little business units. We want them to be well-funded. We've got a whole financial design, how that can happen. But now kind of these individual health units, they can be in the villages with a motorbike, with a boda to be able to go out to the people, and we can turn them into a real business, because we can now, we'll have the information on the local people, what drugs they need, what blood tests they need to be able to do. So it's a whole ecosystem, and of course it will include the pharmacies, laboratories, health insurance companies. And then, of course, the most important for you is the government, that the government can be overseeing, supervising, getting data. And then with all of this, of course, you've got the clinical research and medical analytics. And I'm going to give you a quick tour, although I hope it'll be as quick as I'd like to think it can be. So I'm going to stop sharing this screen, and I'm now going to go back to share my my home screen on my phone. And I'm going to give you, just at a very high level, we've developed applications for the patients. So this is our LifeHealth wallet. So this is a wallet which we've designed for the individuals, as you can see, starting from the top. We've got it translated into many languages. I imagine that, the Swahili kind of would be the language of choice. You can always add extra languages. So here you see that we've put it all into Swahili. And then as I'm going to put it back into English, because other than Akuno Matata and Jambowana, my Swahili, after all these years, is still not very good. The next piece, just to go along, is notifications. So any notifications that a patient may be getting in order to remind them to take their medication, to re-speak to their doctor, etc. You've got over here kind of that you have a doctor request to view and accept. We give control within this application to the patient to decide who he would like to be able to, which doctors they'd like to be able to see. So here you'll see your view. And then in the event that you don't like a particular doctor anymore, you can then review your set permissions, and then you can revoke access to the different doctors. Now, what we're also doing now, which is something which I think is very critical, we're just in the process of upgrading our application. So I'm going to show you kind of the demo, the app that's not quite working yet. But over here, let's say kind of a patient would like a particular doctor to see their record, because this particular doctor doesn't have access. So this is the anchor, the core of the whole concept of the portability and interoperability. So now a patient would say to the doctor, please, I want to jump to the system. I want my Dr. Malongo to be able to see my records. So then you'll be able to go and say, okay, they want them to see medical history and medical visits and prescriptions. You click save, you send and then they'll be able to scan the code, or they'll be able to send a link. We'll put in some extra levels of protections, but now you'll be able to go and send it to whoever it is you want to send it to. And then let's say we're going to I'll send it to myself for now. And then you'll see, kind of that Michael Landau, the Dr. Michael Landau got it. I've got 15 minutes. I click on the button. It's going to ask me to fill out my basic information so that they know kind of who I am as a doctor. So that way we can have a record, and then the doctor will then get access to the medical record. And again, I'm just going to switch from one program to another program. So now I'm going to go to the back end of the record so that you can have a quick view of what the back end looks like. So over here, this is now Michael Landau's record. So the doctor who will only be able to use this in a view-only perspective, maybe we'll give them the option that they can actually use this. But obviously our idea is that this should be the platform that is going to be ubiquitous. Over here, you'll see the profile of the patient. So if the patient, their NHIF number, or if they may have other insurance, other family members on the platform, right? So there's basic, you've got all of your bio data, you've got your contact information, allergies, current medication, medical conditions. And then over here, you see overview, you'll be able to see the patient's history of their blood pressure. You'll be able to see kind of their lab results. And then you'll be able to see when you go to the patient visit, you'll be able to go and see, kind of the presenting complaint. You'll be able to see the treatment notes, but more importantly, you can go into the history of the patient. So you'll be able to see all the previous visits, all the previous labs on different dates that were ordered, the previous vitals on different dates, right? Kind of each one kind of separated out, different action plans on each time, the different prescription histories. So all the information is right here in the system. So this way, this is the, kind of our version of your version of a superhighway. And obviously, kind of, and I'll show you kind of how we've developed it, kind of even further. So, because I understand, kind of the key for a government is to make sure that the people have got good service, and that, kind of the governments make sure that the services are appropriate, they're priced correctly. And so we believe that we would make a very good partner kind of for the government. Again, just quickly going back here just to show you some other features. So over here, you've got location. I'm at 450 West End Avenue, so it's going to pop up. Current location 450. So in the event that the government, wants to do for pandemic preparedness, or you want to be able to see, heat maps of areas, or if there's an outbreak of any particular malaria in a particular place, or even just for the efficiencies of being able to identify people with problems in certain areas. Obviously, it's endless, the importance of being able to do locational data. So we take current location, home location, work location. So let me just continue here. And then I'm just going to go back to the original app. I'm just a bit more familiar with it. So here you'll be able to see kind of your medical history, all your medical conditions, all your consents, all your hearing, your drug allergies, etc. And then over here, and you'll have good questions like, how does the information get in? How does it get verified? Who verifies it? So everything is put in. Some information can be put in like this information by the patient, but it can only be verified by a doctor. So we've got all of these, and this obviously can be for deeper discussions. Something like sickle cell, if a patient has got sickle cell. So what we've also created is what we call the deep dive data questionnaire. So this way the patients will give us consent. They'll give us information about their sickle cell. They'll tell us, kind of this, most of this will all be automatically set up because I'm in New York. I don't have it automatically set for me, but otherwise the patient will be automatic. And I'll show you soon how this data gets into the system. You can imagine, kind of what research can be done with the value of all this data. Here your vaccination history. So you've got your chickenpox, you've got who gave it to you, when it was given to you, the serial number, which of course is very important, the serial number, because that's also part of the whole system of being able to be able to verify if somebody gets a bad vaccine system, we can track where it came from. We'll be able to do this for supply chain management. There's a whole variety. And we've also created what we call the vaccine pass. So let's say, kind of a child's going to school and the parents need to send in their vaccine records. So again, they can share it, a warning, accept, right? And then they'd be able to go and share the data. So we've got the same thing with vitals. You'll be able to see kind of all of the vitals over here. For all the different ones, we've created a concept called the 4W. So this is the 4Ws of healthcare. So you see that your number is 149/91. So you see it's high. It'll tell you everything you need to know about blood pressure, but it'll also tell everywhere you see a 4W symbol, you'll be able to see everything about it. Here you go to the lab tests. You'll be able to go and see your CBC readings, for example. 4W will explain what they are, and it'll explain, and then you'll be able to go and click on the WBC form, and it'll be able to now give you kind of your charts for all your different bloods. So again, very comprehensive, the system. And then, of course, we're building out AI. And by the way, we're partners with IBM. We're partners with the NHS in the UK. We've got some this is a serious collaboration of some big players. We've built the same thing here for mental health. So you can do mental health assessments, and you've got a history of the scores of the mental health. We've got information on clinical trials, information on the history of the prescriptions. So within the prescriptions, we're working on some very clever artificial intelligence, but it's such that we'll be able to track, kind of how well each patient did with the different drugs that they took, and which will be very valuable for any national drug authority to be able to track. So again, obviously, each of these are a discussion, but there's lots what to discuss, we believe. Here you've got your medical history. So this will be, different hospitals, different doctors, hospital visits, telemedicine visits, mental health visits, and you'll be able to go and see kind of the history, let's say, of the CTC. Kind of you made a particular visit over here with vomiting, right? What was the complaint? Was the investigation? This is really me just making it being just rather random. And then we've got the whole thing of the QR codes. So this QR code can be read by, so let's say the patient is going to get a prescription. He can see it. The patient is going to see get a blood test. The blood test people scan it. The doctor scans it with permission. He gets in. Without permission, he can then go and send a request to the patient. Will you let me look at your medical records? So it's all very, very powerful, controlled information. And we're going to switch back here to this health. So now when a patient wants to call the doctor, so we're going to be able to go and choose, kind of the different doctors. We're going to be looking here for the general doctor, specific one, Michael Akiki. I mentioned to you that is my alter ego name. But now before I make the phone call, I'm going to be clicking on, kind of and this can all be in Swahili, but still not everybody reads and not everybody really understands. So we make it as user-friendly as possible to be able to, let's say somebody is tense and severe, we submit, and then we give people a choice. They can either add another symptom, which we will do, and then let's say kind of we want to do the back, lower back, swelling, and painful swelling, severe painful swelling of the back. And then you can add a photo, or you can go and make a call straight away. So I think hopefully kind of you get the idea of the power of the system. Then we've done the same thing for the health workers themselves. So the health workers, and in your country, I know you've got a whole beautiful program that you've set up for the health workers. So we're not trying to say that ours is better or not. We're just showing you what we've built. And we can certainly integrate with anything, of course, that the government has already built. But now we're going to go and look for Michael Landau. Michael Landau is, I cannot see any of the other people. I can see Michael Landau. And from here, I can go and see the medical profile, all the things that we saw before, 149/40/91. I can also see kind of the whole history of all of the different prescriptions, all the different vitals. I can see kind of the vaccination history. I can go and see the medical history. This is where the doctor or health worker can edit the information. And one of the things I didn't show you before, but this is where our AI kicks in, where we start to do, the health status. So here it is stage 2 hypertension. And now if you want to go and add a vital, so we can go and add a vital, let's go and make it normal. So we'll go and do 111/71, right? We pick the date and the time. And this also allows us to be able to go historically. A health worker can put in information. We've got the same thing with vaccinations, right? I'm not going to do it because, again, we're just short of time, but you can scan the barcode. And we've also got new technology that we're integrating to be able to do people validation. So we'll be able to guarantee that the national ID card or the driver's license that people use in Kenya is 100%, is 99.5% government issued. And then using the biometric of the person shaking his face, we'll be able to then verify that this is the same person. So we'll be able to do the time, date, location, lots of different verification aspects that we're going to be able to do. We can go and check, the patient can check old medical visits, but more importantly, they can go and create a whole new visit. And we can make this more simple. If let's say it's just a home health worker and this is too complicated, we can create a special way, kind of to be able to do this. So now just very quickly, going back into the patient wallet. So now kind of we showed that we changed the health status. Now it's normal because we made it normal. And now we check on the vitals. Now you see it's 111/71. So this is just like a little preview. So this is what we've done for the health, for the patient and for the health worker. And now I'd like to show you, this is what we're doing for the health facilities. Right. So for the health facility themselves, we're building what we call the CHIP, right, which is the Community Health Information Platform. We've designed it so that all the information that we collect is automatically collected using special forms that we use, and these forms could be used for any purpose. This is how we've designed it for the health facility, and I'll show you like the level of the facility, the type facility. So there's a lot of information over here. So from this information, we are going to now populate a homepage for every hospital, so all 11,000 facilities in Kenya. If this is the way you would like to go, we obviously hope it is. We'll be able to create for you a complete comprehensive system over here that every health facility will be able to have their own dashboard. They'll be able to have their own, what we call the BIP, which is they'll be able to how many patients, how many things were diagnosed, the different lab requests, the different drugs that were ordered, what's low on inventory, and what drugs are expiring soon. Because what we're really doing is we're taking a good HMIS system, which is our own, And we're now going to be able to extract it so that every health facility will be able to see their own information. And then they'll also automatically, the triaging, it's all automatically done. Every patient, we know who they are, we know why they're coming in. So what we built over here, this is what we built for a district in Uganda. Again, it's easier for me to show this, but we have done some things, kind of in Trans Nzoia, right? So this is like a bit of a map for Trans Nzoia Medical, but we've done something very similar to this in terms of the being able to go and map out all the health facilities. But imagine that this was the whole of Kenya, but this is really just a district in Uganda. So you've got 47 health facilities, you know who owns them. Let's say you wanted to do, and do what their waste, electricity, pandemic preparedness, do they have Wi-Fi, do they have maternal departments, have they got research departments, HIV, pharmacy, and we can do deep dives into all of this information. It all just depends. Do they have sickle cell treatments? Do they have, what's their administrative staff like? What's their medical staff? What are the hours of operation, the level of operation? This is really just limited by the data that we collect. That will be your decision of what sort of data you want to collect. But in each area, we put in the population, so they see their population areas, how many households. We've got a special feature here called the Life Connect. This Life Connect feature will allow it will allow let's say as a ministry, you'd like to have a meeting with all the heads of departments. You can send an SMS notification, do a Zoom invitation to them. But it's, as I said, it's very comprehensive, and we can drill down. So you'll be able to see just one particular district. Let's say you want to see, the district, the parish of Buikwe. Right, so you can choose the parish of Buikwe. It'll take you down to 4 facilities. You'll be able to see how many are government owned, right? You'll be able to see, you see there's only it'll populate in a moment. 3 are private. One is government facility. So you want to know more about the government facility. So you've got all of this information. But then what's happening, and then you got different sorts of maps that you can be using to be able to go and visualize. But then all of the data that comes into the forms over here. So that way, for the whole of Buikwe, we can now be, managing and seeing. Let me just take it back to the whole of Buikwe. So we just reset it. So now from the whole of Buikwe perspective, now the ministry, this isn't rolled out yet in the whole of Buikwe. It's only working in a few hospitals in this Buikwe parish. So, but if let's say this is all the DHIS2 information plus, right? So we'll be able to go and populate whatever information. The hospital will have their own dashboard with all of this information also, but you want to know how many people came in, how many new deliveries were there, how many children are fully vaccinated this year, the number of ANC, all the different bits of information that you need, the number of pregnant people at any given point in time, the number. And then if you want to be tracking how many nets were given out, how many people got the yellow fever, it's just all the information is here. And we can drill down. This is already how we're able to take the medical data and start doing analytics. So we've created this whole concept for digital blood banking, something that I forgot to show you before, but we've got a card. It's actually been approved in Kenya already. 4 drops of blood on the card, and you can have a permanent record. So if you're looking to do a digital blood bank, instead of waiting for some young lady, right, who's going to maternal mortality, the highest rate is because of people who die, young women who die because they couldn't get the blood in time, because Kampala, or in your case, because you see it's a big country, you don't necessarily have the blood banks everywhere. And even if you do, you don't necessarily have the blood that you need. So let's say now the young ladies in the parish of Lagoba. And again, I'm not going to do the whole thing, but I think you'll get the idea. Right, she's in Lagoba. We can drill down. Okay, let's see Lagoba. How many people do we have in Lagoba? So this is all fake data, because obviously we can't show real people's data, right? And then we'll say, okay, there are 282. How many people have agreed to be a blood donor? How many people have got H? We want negative H, hepatitis A, hepatitis B. You clearly don't want somebody who's got positive HIV. And you can't give blood from somebody who's between the age of 0 and 16. So let's say, blood will be given from age 18 to 60, right? I don't know, for some reason I've got a little glitch over here, right? So let's just say ages from, 19 to 60, right? And then it's going to eventually bring it down to some 80-something people. And then you can choose, then you can see, okay, if the woman is O negative blood, right? So, how many people with O negative blood are there that we can go and reach out to? Eventually, it'll come down to one person. It'll narrow it down to one person. And then you use the Life Connect, connect with them, and you can go and save this person's life, because every health facility will have a blood transfusion. You could do some rapid diagnostic tests to be able to do that. But I'm just showing you the just high level. You can do heat maps with all the diseases throughout the country, knowing where things are going on. If you see a malaria, there's a particular concentration, you can say, oh my goodness, what's going on? And then you can do a deeper dive. As I said, we create all the data by having forms that people fill out. And then this is another thing for the village health teams, because I know you've got many, many, many tens of thousands, maybe over 100,000 of them around the country. Well, we've got, again, using the similar sort of tools, and we've also got tracking tools. You can actually know where they all are. You can know information about them. Let's say you want to know how many are parts of a community outreach program, how many of those have got access to electricity, how many of those have got access to the internet, how many of those are traveling around with equipment, medical equipment, right? So it's just a very comprehensive system. And then all of that, we've then got tools that we can actually design, let's say you need to deliver something from here, and, and you need to send it to over here, right? And you can do this for the whole country. So we'll be able to tell you exactly, this is the route, it's middle of the night, so it shouldn't take too long, right? But we can design it that you can manage it all. You can see what's near you. We've got tremendous, this is, we're a partner with Esri. So, and we've got access, we're partners with the American Esri. So we've got access to incredible tools, that can be deployed, kind of from just, kind of incredible number of different sorts of resources. So this can be used to be able to manage an EMS system for the country, a 911, we call it 911 in America. But this is, anyway, I'm giving you kind of a bit of a big overview. I'm going to stop sharing my screen at this point. I know it's 20 minutes, and I apologize for it being so long, but I just wanted to give you an idea of the comprehensiveness of, we really feel very confident, and it's us. We'll be coming with IBM, with Microsoft, and, we're bringing them in as our partners with Esri, with the NHS, and we've just got endless vision but because we're the private sector, we know how to execute, and we would work together with you. And I hope that this has not been too long, and I hope this has been interesting. And I really hope that you give us the opportunity to work with your teams. We won't embarrass anybody and say, hey, your work was no good. Everybody's work is great. We can integrate into any things that exist, but to the extent that they don't, we've got them. And I know that for the president, it's like, kind of he's very, very focused on being able to deliver a solution. I am very confident, and forgive me for being confident, but I'm very confident that yourself, I hope, and certainly the president, this fits in nicely with their vision. We're very close with Anthony Gitau. I'm sure you know Anthony, or if you don't, he's from Johnson & Johnson. He's one of the people that have been driving this whole initiative. And I'm sure, as I said, we've got many people in common, but they're very supportive of what we're doing. And we obviously understand there's a lot of politics. We can help work within the political scheme. We're working very closely with Dr. Camarogo, with the Great Lakes region, and with his, and he's an old personal friend of mine. We're working with Dr. Papella. We're working in the, with Transoya. We've got agreements with a couple of counties. So we're, as I said, my apologies for speaking so long. But I really hope that we have the opportunity. And if anybody else is watching this video, like Dr. Manya, if you're watching it, we really appreciate the support. And to all the other people in the community of digital healthcare, we know that everybody's got a beautiful vision to be able to empower the people. And we want to be your partner to help empower the people. So I thank you very, very much. And as I said, I hope it wasn't too long. Have a wonderful, wonderful day.